I'm with Dr. David Albert. He's the Chief Medical Officer and inventor of the AliveCor device. Dr. Dave, welcome to the show.
Thank you, Kevin. It's a pleasure.
So you have been one of the pioneers in entrepreneurship within electrophysiology your entire career. Even though we both trained at Duke at a great academic institution, you've kind of led the way. So why do you think entrepreneurship and innovation is so important in EP?
Well, first of all, it's a highly technical subspecialty. We have to use all kinds of sophisticated equipment, whether it's a mapping system, whether it's integrating that with imaging, transesophageal echo, MRI, CT. All the technologies of modern medicine are utilized by electrophysiologists every day. Implantable devices, CIEDs, whether implantable defibrillators, biventricular pacemakers. And that sophistication and that exposure and that utilization of technology is a perfect venue to stimulate someone's creative and entrepreneurial insights. And so I think it's just natural.
So you and I both have, undertaken alternative careers in EP. We were electrophysiologists, we ablated, we took care of patients, but now I'm the CEO of a software company in the remote monitoring space, and you run AliveCor as the Chief Medical Officer. So what advice do you have for young EP doctors who may want to pursue an alternative career in medicine?
Well, I think young doctors need to understand patient care, need to get exposure, because that's how you see the problems. Innovation comes when you see a new way to solve an old problem. So I would recommend, and I have lots of young physicians come to me saying, I want to do what you did. I want to become an entrepreneur. I want to start a company. And I tell them, well, first of all, get some experience, taking care of patients, understanding the problems. For electrophysiology, in the EP lab, in the implantable lab, in the clinic, dealing with all the different types of patients with heart rhythm problems, heart failure. And then you'll be able to see, where can I make something better? And so I encourage them first, don't just dive in. I dove in way too early, and I'm a persistent guy, so I survived. But I would recommend, do more like what you did, Kevin, and practice and understand all the issues before you dove into an entrepreneurial venture.
I think that's great advice. Experience goes a long way. I'd like to ask you, what do you think the most important innovation or the future of EP really looks like 5 years down the road? What are we going to be doing? Are we going to be ablating? Are we going to be just putting in devices? There's going to be something else out there. What do entrepreneurs need to focus on in the next 5 years?
Well, we're all waiting for Cabana.
Right.
So that's going to tell us tomorrow something. Whether or not it'll change behavior in terms of ablation, I don't know, one way or the other. The issues will be, we usually improve in incremental steps. So the outcomes of AF ablation have improved over the last 15, 20 years, but it's still not a perfect solution. A number of patients still go back for multiple ablations. So I think that will continue to improve. When it comes to implantable devices, I see the future for hip-bundle pacing, as do many people. I mean, if you can restore true physiologic conduction and contraction, then that's got to be better than the struggles of trying to put something down the coronary sinus and find an optimal space. And that's improved, but physiology, normal physiology will win out. So I think that's an area of innovation. And then there's some really exciting things, restoring function to dead tissue. Dawn Pedrovi from Mayo Clinic is doing some really exciting things with carbon nanotubes and bypassing areas of blockage. So I think and also genetics. Every part of medicine is going to be impacted. We're going to know whether it's a long QT or whether it's an AF risk genotype. We're going to understand that better and be able to hopefully prevent, not just treat.
One last question. What is the most important lesson that you learned as an entrepreneur in medicine?
Persistence. You better be able to cross the chasm, as they talk about, because it's not always going to be wine and roses. Sometimes it's going to be very difficult, and you're going to run into problems, and you need to just be persistent and work your way through those. And I would tell any entrepreneur, it's never going to be perfect all the time, and you better stick with it.
Well, Dr. Dave, thank you for being on the show today. You've always been a great mentor to me and many other people at this meeting, and we look forward to seeing what Dr. Dave does next.
Thank you, Kevin. My pleasure.